Good morning, and thank you for joining me this morning. Thank you for accommodating our unusual change in schedule. We're thinking about those in Afghanistan, and thinking about those in Haiti, thinking about those on the West Coast, and although it's not much we can do here in Savannah, I think that when you consider your own issues and then you see what people are going through, it makes you grateful for your situation, for whatever it is. So our thoughts are with them. Our hearts are saddened by the passing this weekend of Representative Mickey Stevens. Mickey Stevens meant a lot of different things to different people. To Gloria, he was a husband. To Carlos and Edward Jr., he was a father. To thousands, he was a teacher, a coach. To the residents of the 165th House District, he was their champion in the Georgia Dome. To the Georgia Legislative Delegation, he was a trusted and reliable colleague. And to me, he was a friend, my fraternity brother, and one of my earliest and constant political supporters. His legacy of advocacy on behalf of young people and his constituents will always be remembered and cherished by our city. So we send out condolences, but gratefulness for a well-lived life of Representative Edward Mickey Stevens. The long-awaited census results were released last week and were essentially in line with what we expected. We believed, and we still hold the belief, that the pandemic led to some undercounting in some areas of our community. It is what it is. We were not the only community that had those challenges. We expected that Chatham County's population would grow, and it did, growing 11.4%, totaling 295,291, and as expected, our community grew more racially diverse. Bryan and Effingham counties, as expected, grew at much faster rates, 48% and 24% respectively. Even with the explosive growth in Bryan and Effingham counties, Chatham County still represents 73% of the Tri-County's area's population. And the city of Savannah, as expected, still maintains more than 50% of Chatham County's total population, albeit by a increasingly slim margin, but we're still 50% of Chatham. As expected, Savannah's surrounding municipalities saw large population growth. Pooler, Garden City, and Port Wentworth saw growth levels at 17.2, 34.3, and 110.3, respectively. Our city has also become more diverse, as expected. Savannah's black population, or black residents, dropped from 55.4% to 49.1%, a loss of almost 3,000 residents, and that number 3,000 resonates here. Our white residents dropped from 38.3% to 37.9%. Our Hispanic and Latino residents increased from 4.7% to 6.6%, an increase of about 3,000 residents. And our Asian residents increased from 2% to 3.8%, an increase of almost 3,000 residents. So we believe that there are many reasons for this population shift, many which are consistent with national trends, as suburbia has become more attractive to urban dwellers. As people do better, people want more land for their money, and cities generally can't provide the acreage, oftentimes cannot provide the new construction, so people want to remain within the area, but then will find neighboring bedroom communities by which to do that. So we understand that. We also understand that locally, our housing affordability remains a challenge for many Savannahans, and our administration has proactively attempted to tackle these issues with the Housing Savannah Task Force, which has presented to the public Savannah's first ever affordable housing plan. It will make housing affordable, available, and accessible for Savannahans. I am hoping that this plan will be adopted by council sometime maybe next month, and to have the non-government organization that is recommended by the plan launched in January to administer our affordable housing plan. We also have to recognize that only about 45% of the City of Savannah employees actually live in the City of Savannah, which means we have some work to do, and perhaps to investigate various incentives to make living in Savannah more attractive to City of Savannah employees. It makes no sense to me that money made in the City of Savannah is invested outside of our city. So we have to become more competitive, and so we'll be looking at ways to do that. Further, the creation of the OLA Task Force, the PROUD Task Force, and the soon-to-be announced AAPI, Asian American Pacific Islander Task Force, will be creating and are creating mutually beneficial relationships and partnerships with our growing communities to proactively address their unique needs. COVID is growing out of control in our city, and if things don't change quickly, increased measures will be necessary to protect public health, safety, and welfare. Tourism continues to boom in our city, but as someone who is often out in these streets, I see packed indoor locations, I see packed tour vehicles, and very few people wearing masks, which means that unfortunately a lot of us are not taking the situation as seriously as we should. Some more restrictions may be necessary. We instituted the mask mandate as a precautionary measure to emphasize the importance of our impending situation, to increase vaccinations, and to slow the spread of COVID-19. Obviously, this is not working as we had hoped. So this week, I will be meeting again with our medical advisory team to reassess our situation and to seek recommendations. It appears to me at this point that without any substantial change in our compliance with the current mandate or our vaccination rate, further restrictions, permit suspensions, and cancellations are imminent. We tried to do what we could with minimal disruption, but it appears not to be working as we have hoped. So additional action may be necessary and probably soon to come. So stay tuned. Chatham County's 7-day rolling average of new cases was 235.6 as of August the 12th, another all-time high. As of Friday, our community transmission index was 998. Less than a week ago, it was 767. On June 28th, it was 41. June 28th, 41. Friday, 998. As a reminder, the Community Transmission Index represents the number of individuals per 100,000 testing positive for COVID in our county in the last 14 days. And so that is 1% of our population which has tested positive for COVID in the last 2 weeks. Our positive test percentage is now consistently greater than 20% after being just 3.5% on July the 9th. As of Friday, more than 221 people are in Chatham County hospitals with COVID-19, which is our highest number ever. And it's been reported to me that of those in the hospital, almost 90% of those in the hospital because of COVID are unvaccinated. So we've had breakthrough cases, but those are far and few between. The majority of those in the hospital with COVID are unvaccinated. So simply put, our numbers are terrible, they're horrible, they're abysmal. Until more of us are vaccinated, again, I implore you to wear a mask, wash your hands, and socially distance when we're around people who are not in our household. Savannah's mask mandate requires people to wear a mask or a face covering in City of Savannah government buildings, hospitals, early childhood centers, elementary and secondary institutions, guided tours within a vehicle, and on federally regulated transportation. And we'll start enforcing that in a big way. All restaurants, retail stores, grocery stores, and pharmacies in the city are strongly encouraged, again, to require their employees to wear a mask when having face-to-face interactions with the public. Anyone entering into a commercial establishment in the city, again, strongly advised to wear a mask while inside. None of us want to take a backward step, but wearing a mask is simple. Wearing a mask prevents us from canceling stuff, from restricting stuff, from putting us in a situation, in a place that we vowed we would not come to. So the current emergency order remains in place until 11:59 on August the 25th, and then we'll make some decisions about that. The best way to reduce the spread of COVID-19 is to get a vaccine, end of story, and period. So we keep asking people to get a vaccination. Vaccinations are free and safe, and we have plenty of vaccines available. If you're 12 years of age or older, we're asking you to visit your family doctor, your pharmacy, health center, or any county health department, or even the coastal health district. As a reminder, you can get a vaccine on Thursdays from 9 a.m. to 3 at the Savannah Fire Headquarters, known as Station 3, at 121 East Oglethorpe Avenue in downtown Savannah. As you know, this location replaced the Savannah Civic Center's location, and it allows our health professionals to focus on increased demand for COVID testing that is available at the Civic Center. Thanks to the Chatham County Health Department and CORE for their public vaccination clinics this weekend at Forsyth Park and at Grayson Stadium. And I was out there with them for a while, and it was encouraging to see a steady stream of people getting their vaccinations for the first time. If you need a COVID test, you can get one at the Savannah Civic Center, Monday through Friday from 8:30 a.m. to 3:30 p.m., and every first and third Saturday of the month from 8:30 a.m. to 11:30 a.m. If you need a COVID test, the Coastal Health District strongly recommends that you pre-register at covidtestsavannah.org or by calling 912-230-9744, but it is not required. Demand has been extremely high, though. In other news, the next class of our Construction Ready program starts on August the 23rd, and the applications are still being accepted at constructionready.org/new career. Constructionready.org/new career. This unique program prepares participants for great paying construction careers after just 20 days of training. And best of all, the training is free, and you do not need any experience. So if you know of someone for who this program might be a good fit, we want them to sign up today. And shouts out to WorkSource Coastal and the Construction Education Foundation of Georgia for their partnership to deliver this fantastic opportunity to Savannahans. And speaking of new careers, the employment office at the in-market arena has reopened as the city of Savannah continues its commitment to hiring local residents to complete the arena, which is the highest and largest investment in a municipal construction project in our city's history. The City of Savannah's Economic Development Department and WorkSource Coastal will have representatives available on site, and office hours will be held Monday through Friday from 9 a.m. to 4 p.m. The office is located at 620 Stiles Avenue, 620 Stiles Avenue. Help is available for residents completing job applications, for hiring opportunities, and contracted MWBE and DBE firms to support their participation in the project. Job seekers who cannot come to the site to apply can contact 912-659-3555 for assistance. Resumes are accepted but are not necessary or not required, and unskilled labor positions are available. In addition, we're pleased to be working with our Working Savannah Task Force. We'll be holding a job fair on this Thursday from 11 a.m. to 6 p.m. at the Savannah Civic Center. So as you can see, there are a lot of opportunities for people to be employed, and we want people to take advantage of it. Take a quick water break here. It's getting rough. Last week, the Savannah City Council voted 6-3 to maintain a millage rate of 12.739 mils. As discussed during the past few weeks, the city's tax rate has not increased. It is the same as it was in January, although a quirky, nonsensical state law requires that if we maintain the current tax rate, then it is advertised as a tax increase. It is confusing, it does not make sense, but that is a state law. But the reality for the City of Savannah residents is that your tax rate has remained the same. Now, for some people, depending on your valuation, then of course your tax bill may go up. But even if we reduced it, depending on your valuation, your tax rate might still go up. And so tax rates are determined, your tax bill is determined by the City of Savannah, by Chatham County, by the school board, and all of these entities play into that. The CAT has a millage in that as well. And so it's important for people to understand that there are many factors affecting their tax bill. The City of Savannah can maintain it, the county can raise it, and your tax bill goes up. We can all maintain the same thing. Your value goes up, so then your taxes go up. So I know that there was a lot of confusion. It appeared to be some confusion even among our council members, but our millage rate, our tax rate, remains exactly the same. The city manager has informed us that maintaining the current rate will save us about $2 million. So I'm hoping that we can translate that quickly into long overdue and well-deserved raises for Team Savannah, who continue to perform admirably during these particularly challenging times. And I look forward to continued discussions of how we can equitably distribute the city's budget to provide for the service needs of all Savannahans. People want a certain level and expect a certain level of service from the City of Savannah. And so being a large organization that provides these services cost. And so it's important for us to be able to provide them. When we started reducing services, that I remember due to service cutbacks, of course people were upset. Well, why are you doing this? Why are you doing that? I mean, the fact of the matter is the city has to be able to maintain the service level that people expect for us to have. We also voted unanimously to approve a contract for Mr. Jay Melder, our new city manager. Mr. Melder's contract provides for a salary of $260,000 annually, which is in line with the salary of other public sector executives in Chatham County. He begins work in Savannah on September 10th, and we cannot wait to welcome him to the team. I particularly appreciate interim city manager Heath Lloyd, who has been quarterbacking and managing that process internally. In addition, City Council began the process of redeveloping another property on Cummings Street. This maintains the city's multi-year commitment to eliminating blight on the street and provides for the development of a quality, affordable home for a Savannaian to purchase. Anyone interested in viewing follow-up questions from the public meetings regarding the fairgrounds proposals can now do so by visiting savannahga.gov and looking at the top stories section on the home page. If you remember, we had the 2 public meetings, we had the council presentation. Some questions were asked by council members that extended beyond the 30-minute time period, and so we asked council members to commit those questions in writing. We would ask those questions of all 3 proposals, and then we would take those answers to those questions and make them available to the public. So we have done that. And again, Thursday, we're looking forward to having folks to come to our job fair with Working Savannah at the Savannah Civic Center from 11 to 6. And we're asking people to come out and, again, opportunities here for people. There should be no one unemployed in our community right now. If you want to work, there's opportunities out there for you. So that ends my prepared remarks, and I'll entertain any questions you may have.
Good morning.
Good morning.
As you look at the COVID data for our area, what's kind of the threshold or breaking point that would cause you to reinstate those restrictions you mentioned?
I think we're there. Again, we have tried very hard to not make it a political decision, but to make it a medical and public health decision. Hence why I've had a wonderful team of medical epidemiology and public health professionals who have been guiding us. And so no decision we have made has been in absence of their recommendations. Again, personally, we are worse now than we were when we were closed. Worse now. And so therefore, that's my thoughts regarding it, but again, we're going to ask them. And so, you know, I know that if it's not working, then we have to do some things to reduce our exposure. And so we have very big events planned. We have relatively small events planned. You know, where do we get where we can start reducing our spread? And so that's a question essentially I'll be asking them. And so from the advice they give us, there'll probably come some other order regarding that.
Once this current mask mandate expires at the end of the month, is there any plan to change it? I know it's a little bit different from your initial one last year, you know, not requiring people to wear the mask outside. Any plans to change that at all?
That'll be one of the questions I asked the medical team. It's very likely that the mask mandate might change. Again, this was a warning shot saying, hey, our numbers are getting bad. Let us do what we can to kind of help slow down this spread. Some are taking it seriously. Everybody is not. And so, you know, we do what we have to do. I think people can't say that they were not warned.
Have you heard from any of the business leaders in the city about if people are wearing masks inside stores?
I've talked to many of them, business leaders and business owners. Some are complying. Some saying, well, you know, it's up to them. And, you know, that, you know, again, we try to give them a not only choice, but an opportunity to proactively be engaged in this process. We believe that if the vast majority of people to our community were wearing masks indoors, that would help us to stop the spread. Some businesses said outright they weren't doing it. Oh well. Again, restrictions hurt everybody. Cancellations and permit revocations hurt everybody. And so maybe some of their inactions or some of their inability to really be engaged, again, hurts everybody.
Right now, are there any considerations to require the vaccine for city employees?
Everything is on the table. I have not spoken at length about that with the city manager. We are looking at cities across the country. I do know that the majority of our city employees are not vaccinated. And so they put themselves at risk, they put the rest of our city at risk, and so we have to address what happens. Obviously, I've known of individuals in the last several days that have died because of COVID. And what happens is somebody gets sick, and all of a sudden they want to get the vaccine, or they feel they've been exposed, and then it comes this whole type of panic situation. Again, we'll have to rely on our medical professionals and the city manager making some determination, and we'll go from there.
Do you know what percentage of city employees are vaccinated?
Pardon?
Do you know what percentage of city employees?
It was 47%. So that means 53% of our employees are not. And that's 53 of about 2,500 employees or so. 2,400? Okay. So, and they live all over the place. And they come in contact with the people. And some are police officers, and some are firefighters. Some are in situations where they can't avoid not coming in close contact or close proximity with people. We care about them. We have a number of employees that have COVID that are out because of COVID. We're hoping and praying for their recovery. But again, the opportunity is there for people to be vaccinated. And so all we can do is offer the opportunities and hope they take advantage of it.
And last question, switching gears a little bit, I was just wondering if you had any specific memory of Representative Stevens that kind of sticks out to you.
I have several that I really can't talk much about publicly. Well, for me, he was always a type of person, particularly on rough days. He'll call and he'll say something that was quite colorful, that just kind of, changed my whole perspective. Having a rough day, something's going on, he'll call and say, "Hey man, forget those folks." Something along those lines. Just really short, brief conversation. When I was running for office the very first time, he was the first elected official to come to me and say, "Hey, you can use my name." And I will always remember him for that. Because at this point, I'm getting ready to get into this, and nobody really knew of me. People said it was against the tide, and here he was in office and saying, "Hey, you can use my name." So I'll always appreciate him for that.
Thank you.
Thank you.
Good morning.
Good morning.
So based on your conversation with medical professionals and their recommendations, do you foresee imposing further restrictions before the mask mandate expires, or do you think you would wait until?
It's quite possible. I think based on the recommendations, again, I think some of these restrictions are in there. They do. Again, we'll wait till we have those courageous discussions with them, but we're going to base it on the science. And if the recommendations are that we move aggressively and immediately, then you'll see the requisite changes in our mandate.
And then another question, do you foresee maybe expanding public access to the vaccine, or do you think there's not enough demand for that right now in our area?
Man, we all over the place. We were in Forsyth Park over the weekend. There was Grayson Stadium over the weekend. There were J.C. Lewis's in Alderthorpe Mall. Again, I'm working hopefully to get out to some of the nightclubs. I mean, I think we're all over the place. I mean, the interesting thing about it is when people get exposed, they want to get tested. They're calling, where can I get tested? I need to get tested. The same time you used to get tested, you could have gotten vaccinated. And so, you know, again, the health department has launched their Say Yes campaign, and this is statewide. We did it here in Savannah, Chatham over the weekend. We're going to make it available to as many places as wherever people are. You know, we have the vaccines, we have the personnel, we're ready and willing to give. People have to, you know, offer their arms. So, again, if the solution is there and people are not taking advantage of it, that again feeds into our decisions to do some restrictions just to be able to slow things down.
Thank you.
Thank you.
Morning, sir.
Good morning, sir.
So we have a meeting with healthcare leaders happening this week. What day? Do you know yet?
I believe it's happening Thursday. Thursday, Friday, something like that.
So, talk about just expanding restrictions. Would it closely mimic the mandate that we had in place up until midsummer this year?
It could. Again, I don't want to speculate on what it might be because, again, I'm not a medical guy, so I need to talk to medical people. But I could see permits being revoked, some events being postponed or canceled. You know, I could see us limiting the use of the public space for events. And Savannah loses. We lose. But that's the choice we made when we chose not to be vaccinated. That's the choice we made when we chose not to wear a mask. Then we have to intervene, although we don't want to be able to take measures to lessen our exposure, to be able to decrease our spread by keeping people apart. And we don't want to do that. I mean, it was very hard for everybody. But again, you know, this is a reaction to inaction. And, you know, again, the mask mandate redo was a part of telling people we're in a situation now that we have to make these adjustments. We can't just be out here willy-nilly like things. I mean, you know, our city is hot in more reasons than one. We're right down the road from Florida, which is hotter, one of the hottest places in our nation. And, you know, the North is doing it much better, and we're seeing how they are opening up. We're not doing it as well. It should not be political, but it's been made political. And so, as for Savannah, we're going to stay out of that political frame. We're going to base it on medical and public health advice.
And last thing for me, what's the lead time on those potential permit revocations? I know we have a lot of big events coming up in the fall, a couple marathons, you know, festival in the park. What, I guess, would be the lead time on making that decision?
Depends on the advice of medical professionals. You know, some might be immediate. I don't know. It just depends. Obviously, some folks would want to have some understanding, particularly for the fall events, what things are going to be like so they can make some decisions. You know, I don't know. I was supposed to be going to U.S. Conference of Mayors in Austin, Texas. I believe it was in September, and that's been canceled. Again, the numbers in Texas and in Austin are out of control, and so they pulled the plug on an in-person conference. Again, the mayor of Austin was very disappointed, obviously looking forward to welcoming mayors from across the country there, but it's not safe. And so, I hate for us to do that here in Savannah. The folks that visit Savannah and Joe Marinelli and those have worked very hard, worked with us coordinating events, but we're not going to let people come here if it's not safe. We're just not going to do it. It's not safe for us, and it's not safe for them. So we'll see what happens.
Thanks.
Thank you. Anything else? All right. Well, let us stay dry today. Let us do the best we can. Please be vaccinated. Please wear your mask. Please wash your hands. Please watch your distance. Have a good week. May God bless you. May God bless the city of Savannah.